Hi guys, good morning. So this is Miss Ria again, and today we'll be discussing another phase of the nursing process. Need good ninyo ma-master ang art of making a nursing care plan because based on my experience when I was like you guys, pag ma-deploy na mo manggod sa hospital as a nursing students, your clinical instructor with you will going to give you a certain task like magbuhat mo nursing care plan like 8 to 10 maximum of nursing care plan per shift. So kung di gid ninyo ma-master ang paghimo og nursing care plan or that thing that we called NCP, maglisod gyud mo cope guys. So that is why I have to make sure that maybe next week I will going to introduce you guys sa kaning handbook na ginagamit nato pag maghimo tag nursing care plan. Kaning ginatawag nato nga Nanda book. So actually, I will encourage you guys to buy your own handbook, your own Nanda handbook. You can purchase it sa ato ang hospital naman, dira sa ato ang school. Okay, you just ask the cashier or from the accounting office. Ask lang sila na daw sila stock sa Nanda handbook. Amount guys is 1,300 pesos. So you go there and ask for additional information, tagaan mo og Nanda, palito ninyo. Kasi magamit ta ana maybe next week. So I'll be meeting you in Zoom hopefully next week, and I will going to show you the Nanda handbook that we have, and I will going to teach you guys on how to use it. So you really have to buy your own handbook para po at least na may reference ninyo. Unya magamit po na ninyo at the same time pag mag-duty na mo pohon sa hospital. Hopefully kaning wala na ning COVID or at least mag-decrease na ang pattern sa COVID-19. Okay? So now let's discuss the second phase of the nursing process, which is the diagnosing phase. Okay, what is diagnosing? So in diagnosing is the second phase of the nursing process. Can you still remember the ADPI? So don't forget that ADPI guys because you will going to encounter ADPI as you go along with your journey as a nursing students, okay? And of course, during your examination day, it may be local or international, naagi ADPI always. So, di ganyan nyo dapat baliktad-baliktaron, okay? So, nurse uses critical thinking skills and interpret assessment data and identify client strengths and problems. So, diba, we are done with our assessment phase. So, out of your assessment, out of your data that you gathered from your patient or from the family, now you have to formulate your nursing diagnosis, okay? So in 1982, the conference group accepted the name North American Nursing Diagnosis Association. This is what we call NANDA. It's like a taxonomy, guys, that will guide you sa paghimo og nursing care plan. So naa na dito tanan nga inyuhang nursing care plan nga pwede ninyo mahimo sa patient. Okay? So I know it sound confusing karon guys kasi maglisod mo og absorb pa, but hopefully as we go along with our lecture you can actually imagine how Nanda handbook will work sa inyuha as a nursing student. Okay? Now, what is the purpose of Nanda? So, nakapangutana na ba taon sa purpose mi sa Nanda? Nga, kailangan na mo palito na naana. Of course, it used to define, refine, and promote taxonomy of nursing diagnostic terminology. So, in Nanda kasi guys, makita ninyo dito ang mga nursing diagnostic terminology that is applicable for your patient. So, dili tanan nursing diagnostic terminology dito is applicable sa tanang pasyente. We have to select based on what we have assessed or based on our assessment gathered, okay? So, a taxonomy is a classification of system or set of categories arranged based on a single principle or set of principle. So, sa mga pangutana, what is the difference between diagnosing and the diagnosis, okay? Diagnosing naman guys, it refers to the reasoning process. Di ba pag once na-gerund, ing, it's like a process. So diagnosing, okay, assessing, implementing, evaluating. So it's like a process. While kung mag-ingon tag diagnosis, it is a statement or conclusion regarding the nature of the phenomenon. So that's it ha. Don't forget that. Okay, miss, what is nursing diagnosis? Okay? Actually, guys, you can read it sa inyong libro, naara na sa inyong libro. So, composed of the client problem statement. So, client problem statement, plus the etiology, or what is etiology? It is actually the causal relationship between a problem and its related or risk factors, plus the defining characteristics. So mao na siyang format, guys, ha. Ang format is problem, etiology, problem. Makasulat pa ko diri. Di lagi siya. Wait lang, ha. Problem, then etiology. I don't know why is it not working. And the defining characteristics. So, mauna ang pattern nato sa pag maghimo taog na nursing diagnosis. Okay? For example, upon your assessment, subjective wala. Wala man nag-express imong patient na ana-ana siya gibati. But in your objective assessment, you've noticed that the body weight of the patient is 20% under the less normal. So, it means 20% less. It means ano siya, kanang underweight, right? Decreased subcutaneous muscle mass, and there is loss of weight with adequate food intake. So, although appropriate ang food intake sa patient, nagyapoy loss of weight nga manotice. So, our diagnosis for that would be imbalanced nutrition, less than body requirements. This is the problem. Okay? Now, kaning imbalanced nutrition, less than body requirements, makita ninyo ni guys sa Nanda nato. That is why you really have to purchase, you really have to buy your own Nanda handbook. So, dili magkunuramay. Related to, based your assessment, unsa man ang kanigid ang gamito ninyo, guys, related to, mao ang format. Imbalanced nutrition, less than body requirements, which is the problem. Related to, so unsa man ang ato ang etiology this time. Of course, etiology niya is because of less normal body frame, and there is decreased subcutaneous muscle mass. At the same time, there is no proper absorption of nutrients. Okay? Kasi kahit kain siya ng kain, wala may nag-reflect sa iyang weight, di ba? So somehow there is a problem with regards to the absorption of the nutrients. So mauna ato ang related to. So imbalanced nutrition, less than body requirements is the problem. Related to inability to ingest or digest food or absorb nutrients or nausea and vomiting. This is like how mahimo ra na siya. If in case tayo nag-express ang patient or naatay makita ang nausea and vomiting sa patient. But the common factor here is imbalanced nutrition, less than body requirements is the problem, and the etiology is the inability of the patient to absorb nutrients. Okay? So later on, mag-gets ra na ninyo kadugayan. Okay? So client problems, mao ni ato ang pattern plus etiology plus defining characteristic. This defining characteristics, we have to discuss it as we go along with our lecture. Okay? Reminder. Okay, may pa-reminder si NCM 103. The domain of nursing diagnosis includes only to those health states that nurses are educated and licensed to treat. So you cannot actually formulate nursing diagnosis like lung cancer, di ba? Cardiovascular problem, di ba kasi wala na siya sa atuang scope as nurses. So, di ta makabot-bot. But only doctor can do it, okay? Kaya mga lung cancer, heart problem, arrhythmia, mga myocardial infarction. So, I know it's sound confusing sa inyo kasi first year pa mo. But you know, guys, as you go along, nursing is like an interesting subject, especially when you reach your third year college. Kasi dito na nyo ma-encounter mga different diseases, different illnesses, in different systems of your body. For example, nurses are not educated. Diabetes mellitus. Diabetes mellitus is like an increase of increase sugar of your body. Like there is excessive production mo ng mga diabetes na mga pasyente. So you cannot actually like you are not actually allowed to diagnose diabetes mellitus because only the doctor can do it, okay? A nursing diagnosis is a judgment made only after thorough systematic data collection. You cannot actually you cannot actually formulate nursing diagnosis without assessing your patient. Kasi guys, kung mag-duty na mo, tagaan man mo ang pasyente, no? For example, si si China Palma, ma-assign siya ana nga tulo ka pasyente from 211, 212, 213 for example. Si Bilbao ma-assign og another three sets of patients. Si Rodriguez, like that. Ma-assign mo ang patient, for example. And then, out sa inyong patient, himuan na nyo nag-nursing care plan. So, mauni siya ang nursing care plan. Mag-assess mo, i-assess ninyo ang patient, kung saya mag-ipampati. Then, out of the data that you have collected, you can now formulate nursing diagnosis, which is primarily related or connected to your NANDA handbook. Okay? So, describe continuum of health states, deviation from health, presence of risk factors, and areas of enhanced personal growth. Okay, there are four status of nursing diagnosis. So, as what I have remembered when I was during my college years, si Miss Love among instructor that time, among clinical instructor or CI during our related learning experience. And usually si Miss Love yun yung CI yun gihapon. So Miss Love, for example, will give you a certain task, maghipahimuon mo niyag nursing care plan. Usually ang nursing care plan kasi may actual diagnosis, my risk diagnosis, my health diagnosis, and my syndrome diagnosis. But usually, tulo ra gid ang ginapahimuan na actual diagnosis, risk diagnosis, and the health promotion diagnosis. Pahimuon mo nagtulo-tulo or lima-lima, di ba? 15 NCP in that shift, di ba? So, kaya kailangan ninyo siya ma-master gig maayo. Okay? So, there are four status of the nursing diagnosis. So, the first status would be an actual diagnosis. Unsa man ang actual diagnosis means? From the word actual, it is a current problem that is present at the time of the nursing assessment. So kung say nakita ninyo, di ba, kung ang unsa problema sa pasyente upon assessing your patient. Like for example, patient Santos lying in the bed, he cannot move because he was suffering from comatose or bedridden siya for so many years. So unsay problema pa unsay problema ana niya? Of course, immobility, right? So immobile siya, di siya kaliok-liok. So that's our problem based on kung unsa atong makita during the assessment process. So it is based, or another example, upon entering the patient room, you've noticed na your patient is suffering from strangulation. Like for example, naglisod siya ginhawa, okay? So your problem or your diagnosis would be, for example, ineffective airway clearance. If pakita ninyo nga daghan kay siyang plema, or you can say ineffective breathing pattern. Kana akong ipang-mention, guys, confusing lang na siya kasi wala pa may nanda, pero kanang mga ipang-mention ako na mga ineffective breathing pattern, ineffective airway clearance, na siya sa nanda, okay? For example, ineffective breathing pattern related to anxiety. So, mga ganitong pattern, problem related to anxiety, mauna ato ang etiology. Nganong nagkaroon man siya, anong na may problema yung breathing pattern. Okay? It's because she or he is suffering from anxiety. So, that's it. That is what we call actual diagnosis. So, I hope, guys, na makuha ninyo. That is why I really encourage you to watch the lecture because I know bright mo, you can understand by just reading the book, but you don't have the experience yet. So, you have to really, really listen the lecture for your own reference as well. Okay? So, do not think that it's just like an online exam. You just have to, sagdaan lang ninyo, pabayaan lang ninyo because it's just like an online exam. Bahala na, ana. No, you really have to invest in your fundamentals of nursing because this would serve as your foundation sa inyong knowledge as you go along, okay? The second one would be a risk diagnosis or risk nursing diagnosis. It's a clinical judgment. A problem does not exist. Remember, the problem does not exist, but there is a presence already of risk factor that indicates that the problem is likely to develop in the future unless the nurse intervene. So, unsay possible, unsay example na ko ana? The best example would be katong patient. Immobility, di siya kaliok-liok, di ba? It's because he is in coma. or bedridden for so many years. So ang possible ana nga problem is pwede siya risk for infection or risk for tissue like tissue damage like that kasi nga 'di ba kung nag-bedridden ng patient kung dinin mo siya i-turn side to side 'di ba possible nga ang tissue sa iyang likod kanang skin niya pwede na siya due to friction and due to pressure pwede na siya magkaroon siya og decubitus ulcer or pressure sores pwede na siya ma-damage yung skin. Okay? So, which is detrimental. Okay? So, mauna. Another example here is all clients who are admitted in the hospital are risk for infection, of course. But those clients who are suffering from diabetes or compromised immune system is at higher risk than others. So, that's why we say risk for infection related to immunocompromised health system or immune system. So that's risk diagnosis. Okay? You can actually interpret the definition of this diagnosis by just looking or by just try to understand the first word like actual risk. Okay? So the third one would be health promotion diagnosis. It relates to client preparedness to implement behaviors to improve their health condition like readiness to enhance nutrition, readiness to enhance learning. Okay, ganyan. Kani guys, naapo ni sa nandak. So, di na mo malibog ana. It's just a matter of teaching you how to use appropriately or effectively your handbook. So, that is why I hope next week you can actually purchase your own Nanda handbook for your own reference kasi I'll be meeting you as sa Zoom or in Google Meet. I'll just give you further instruction for that meet app so that I can introduce you to you guys our handbook. The fourth one, which is quite uncommon, is syndrome diagnosis. It's assigned by a nurse clinical judgment to describe a cluster of nursing diagnoses that have similar interventions. There are components of Nanda nursing diagnosis. Parang na-mention ko na to kanina. The problem and the definition like risk for infection, di ba? Or shall we say ineffective breathing pattern. That's our problem, okay? Etiology is katong magbutang na mo related to anxiety, related to improper or related to non-absorption of nutrients, okay? Related to increasing phlegm or increasing mucus secretion, okay? That's the etiology. Related to, so what? But that's related to, it should coincide to your assessment. So, dili kayo magbutang-butang mo nito related to increase mucus secretion. Pero sa assessment ninyo, wala mo nagbutang dito og nabay presence of secretion, nabay may madungog sa iyahang breathing pattern nga parang naay mga phlegm, di ba? Dili ingana. Kung unsa inyong gibutang sa related to sa etiology, it should coincide to your assessment. Okay? The third one is the defining characteristics. So let's discuss it one by one. Problem, diagnostic label and definition. So it describes the client problems. It needs to be specific. A nurse should state in the area in which the problem occurs. So, specific yun dapat. Like for example, deficient knowledge. Butang na ninyo dito I don't know why it's not working. Nganong dili na ako magamit akong kamot, I don't know. Deficient knowledge, okay? Dapat naka-specify asa siya deficient. Medication ba? Or there's deficient knowledge in dietary regimen. Pero kung mag-deficient knowledge mo guys, sa yung assessment, dapat mag-manifest po dito na ang patient ninyo naglisod og sabot sa iyang tambal. For example, ingon siya sa inyo, ma'am, kanang unsa man gini akong tambal like lisod og sabot ani wala ko kasabot ana. So, in your nursing diagnosis, pwede mabutang dito deficient knowledge sa medication or deficient knowledge sa dietary regimen. But of course, guys, when you're formulating nursing diagnosis, make sure it's the kailangan po na ito mag-prioritize. For example, na problem sa iyang airway. Ikaduha, na problem sa iyang psychological support. Kailangan ng psychological support. Na problem sa iyang somewhere sa pa ng mga problema like sa iyang diet. Of course, always remember, ako na po ning tips na ihatag sa inyo ha. It's ABC. It's airway, it's breathing, and C for circulation. So, pag mag-prioritize ta guys, unahon ginatong airway. Di ta mo nag-dietary regimen kasi wali man na siya mo na ang problem sa pasyente nga pinakataas na priority kinahanglan nato i-prioritize. Okay, airway ginato unahon, then breathing, and then circulation. So here are the qualifiers that are added to give additional meaning. So these qualifiers, guys, you can actually see it and you can actually read it in your handbook. The first one here is deficient. When I say deficient, inadequate in amount or not sufficient or incomplete, deficient knowledge, okay? Impaired, weakened, reduced, or deteriorated, or impaired mobility, impaired mental capacity, ganyan. The third one would be decrease or lesser in size, amount, and degree. Ineffective is not producing the desired effect or compromise to make vulnerable to threat. So here are some of the qualifiers that are used to give an additional or complementary meaning sa ato ang nursing diagnosis. Here is the example, okay? Diagnosis and definition. When you say activity intolerance, patient cannot move. It's because of maybe insufficient physiological or psychological energy to complete or endure required desired daily activity. So, mao nang problema nato, activity intolerance related to what? Unsa may pwede nato ma-relate? Pwede bed rest or immobility, pwede generalized weakness kasi syempre, for example, your patient is suffering from left-sided brain injury. So, pag once left-sided ang impaired or left ang brain ang affected, it will create a lateral effect. So, ang effect, guys, ang imong right side sa imong body ang ma-paralyze or mag-suffer of weakness. Mauna ha. Kung right naman ang damage sa imong brain, automatically it will create a lateral side effect, which is yung imong lawas sa left side cannot actually do its normal activity. So that's it. So activity intolerance, tas assessment ninyo, stroke ang pasyente. So ang meaning, ang inyong diagnosis is activity intolerance related to generalized weaknesses. Kung generalized kasi gikan siya og surgery, like general anesthesia, under siya general anesthesia. So you can say activity intolerance related to general weakness. Defining characteristic as verbalized by the patient. Ang defining characteristic kasi guys is like based on your assessment. For example, activity intolerance related to baka nakita ninyo dito ang heart rate niya is abnormal or naa siya dyspnea. Diba? Dyspnea is difficulty in breathing, diba? So, activity intolerance, this is your problem, related to generalized weaknesses, that is your related factors, as manifested by, that is your defining characteristic, as manifested by dyspnea. Okay? Tapos ibutang na din mo dito ang imuhang anong makaingon kag dyspnea. Your RR is rate, kasi ang normal RR respiratory rate, I know it sound confusing, but I hope you actually try to follow my lecture. Kasi the normal respiratory rate for adult is 16 to 20 cycles per minute. So, for example, may kag activity intolerance, sa imong assessment kasi, naglisod siya ginhawa, iyang respiratory rate is 25 or 23 cycles per minute. So, it's abnormal, it's beyond range. Okay? So, activity intolerance, related to generalized weakness, is manifested by dyspnea. So, ibutang nimo dito, RR 23 CPM. So, it's like it's actually like a systematized pattern or organizing data from your patient. Gets ninyo guys? Okay. The second one, di ba the problem ang permero? The second one is etiology. Etiology is the related factors and risk factors. So probably cause of health problems. Every etiology should have different intervention. Okay? That is what we call mao ni atong ginabutangan og related to. The third one, defining characteristics, are the cluster of signs and symptoms that indicate the presence of particular diagnostic label. So they are separated whether they are subjective or objective in nature. Okay? Mao na siya. Motoingon ako na. For example, dyspnea. Okay? Nag-express ang patient na naglisod siya ginawa. Patang activity intolerance related to generalized weakness as verbalized by the patient or as manifested by the increased respiratory rate. Man siya. Now, there are different nurse differentiates the nursing diagnosis from medical diagnosis. So I know I've already mentioned this superficially, like what are the differences between independent nursing action and independent nursing function. So when you say independent, of course, areas of healthcare that are unique to nursing and distinct from medical function. Dependent naman is like physician prescribed therapies and treatments. Like your patient will undergo chest x-ray. Nurses cannot do that for their patient. Your patient will undergo guided imagery like mga CT scan, mga unsa pa dira na mga invasive procedure. That's dependent function. Excuse me. In formulating diagnostic association, there are two formats, okay? The first one is the basic two formats, okay? It's like a problem and the etiology, kanilang. Mao ning two parts, problem, etiology. For example, ineffective breathing pattern related to immobility or related to weakness. Maora na siya. Problem ra og etiology. So when you say problem here, the statement of client response, and when you say etiology, factors contributing to or probable cause of the response. There are two parts are joined by word related to. Like for example, anxiety, which is the problem. Related to, mauna ato ang connective links. Okay, mauna ato ang linking verb or somehow like that. And then possible cancer diagnosis is our etiology. Nganong nagka-anxiety ang patient? It's maybe because of the possibility of cancer, the diagnosis of diagnosing the cancer sa iyang case. So, mao nang two parts. Now, let's proceed to the basic three-part statement. Now, this time, na ay problem, na etiology. At the same time, na ay sign and symptoms. Okay, take look sa itong example. Anxiety is the problem, right? Related to is our connective link or our linking verb. Possible cancer diagnosis is our etiology. And then, you have to use another linking verb as manifested by sa imong assessment nakita nimo, for example, increased pulse rate. Kasi the normal pulse rate is 60 to 100 beats per minute, okay? Kung respiratory rate, cycles per minute. When you say kung pulse rate, it's beats per minute. So, as manifested by increased pulse rate, which is pulse rate, butang nimo 113 beats per minute, and excessive sweating. So, mao na siya ang sign and symptoms. So, usually, kung naamoy makita sa inyong assessment na pwede makabutang mo og sign and symptoms, pwede mo proceed maghimo og nursing diagnosis nga using the three-part statement. Pero kung wala mo makita, you can still use this basic two parts, okay? But usually, our clinical instructor will told us or will tell us that somehow you have to put some sign and symptoms na makorelate nimo sa patient condition. Okay. Now, let's proceed to evaluating the quality of the diagnostic association, diagnostic statement. So, in addition to using the correct format, nurses must consider the content of diagnostic statements. So, it should be accurate, concise, descriptive, and specific. So, for example, may yung patient, guys, na, ma'am, sakit akong ulo. You don't need to paraphrase it, okay? Sa inyong assessment, dili nyo butangan dito, the client express for example, tawag na headache. No, you can just put there sakit akong ulo as verbally expressed by the patient. So mao na ibutang niyo sa assessment. You have to you had put your assessment, it should be verbatim. When you say verbatim, it should be kung sa ingon sa patient, ma'am, sakit akong tiyan, as verbalized by the patient. Okay? Tapos, i-supplement mo siya og mga objective kasi katong ingon verbalize subjective man to, right? So i-supplement nimo objective, like putangan nimo tog pulse rate kasi sakit yan siya, nagtaas possible yung pulse rate, na nag-sweat siya, nag-pallor, or there's cyanosis, like for example unsa ba dira ibutang nimo nga related sa patient. Of course dili po ka magbutang-butang og pataka-taka objective, di ba, if dili siya related sa case sa pasyente. The nurse should compare the client risk factors to Nanda risk factors. That's why I really encourage you again to buy your own Nanda handbook. So, avoiding errors in diagnostic reasoning. So, how can we avoid? Kasi somehow, we are nurses can actually commit mistake. But somehow, this book will teach us na how to minimize errors or somehow, to be exact, to avoid errors. Like, for example, the first one is verify. Ask client what their health problems and what causes to be. So it's very essential that you establish rapport, you establish trust towards your clients so that they could actually freely express their thoughts to you as a nurse. Build a good knowledge base and acquire clinical practice. Of course, you have to remain be a teachable person, like you have to receive a proper training, a proper theory, a proper demonstration prior emerging you to the actual scenario, and have a working knowledge of what is normal. That is why student nurses should have or should learn what are the normal ranges of vital sign. Na-discuss na ba na ninyo? So now your task for today is you have to your task would be to segregate or somehow mag-create mo og normal ranges sa vital sign. So mao na inyong for example, ang inyong is ang pulse rates. I-submit niyo sa ako guys ha. What is the normal pulse rate? What is the normal RR, respiratory rate? What is the normal temperature? What is the normal BP or blood pressure? PRRR, temp, BP, mauna siya ang inyong i-submit sa ako tomorrow. Erisa. And then, I also want you as early as now, I know it sounds confusing, but I really want you to memorize or to submit at the same time the normal electrolytes result. Okay? So, the vital sign, the normal electrolyte. So that's kana lang sa akong gusto mabalaan ninyo. Okay? So you have to submit it and sa atong classroom. I will just create a designated assignment for that. That will serve as your second monthly assignment or activity. Okay? So the and of course, you don't need to submit it. I-submit lang ninyo without even memorizing or without even absorbing the content of that. So, pulse rate, our temperature, the normal BP, and the normal electrolytes level. We say electrolytes, your potassium, your sodium, your calcium, your somehow your magnesium, like that, and so forth. Okay? So, I hope guys that you learned something for that tomorrow. And normal vital signs, speech development, normal breath sounds, and compare the data you have collected to their lifestyle and physical makeup. Kasi guys, kung di gino mag-establish of adequate na data gathering, mag-isip mo formulate og nursing diagnosis. Kasi usually guys, mga athlete gaman join og triathlon, usually the compensatory mechanism of their body, usually ang ilahang heart rate is baba sa mga normal na mga adult. Usually 52 ilang range, 52 to 58, which is normal kasi athlete sila. That is why you have to correlate your data gathered or your assessment sa ilang lifestyle. Next would be consult resources, and which is your professional literature, your nursing colleagues. You have to seek help from them. and you improve your critical thinking skills. You help the nurse to be aware and avoid errors in thinking, such as overgeneralizing. So you don't need to overgeneralize, you don't need to stereotype and make unwarranted assumption, because it will just lessen your chance to improve your critical thinking skills. Okay, so I hope you guys that you learned something for today, and I want you guys first is you have to submit katong yatag na ko na assignment. The second one, you have to buy your own Nanda handbook, because maybe next week we'll be dealing with that and I will going to explain it to you very deep. And it's not just a superficial examination. So I want you to have that during our Zoom meetup next week. Okay, so and I hope that you will going to prepare as well, because we will be having our quiz maybe tomorrow, and it would be a long quiz from the beginning of our second monthly lectures and up to this phase, the diagnosing phase. Okay, so that would be all, guys, and I hope you learned something from this lecture, and have a good day.